Hello, viewers. It feels good to know that you are still on with us. It's still your darling station, SGTV, and the program is You and Your Health. COVID-19 appears to be the most populous name around the world now, and that is the newest virus that appear to have taken the global community by surprise, from the Europe to America and to its very source, the Asia. Everybody appear to be running around to see how they find solution to a virus that has been a serious threat to the human race. As a nation, we cannot close our eyes and our ears to what is fast becoming a threat, particularly to Nigeria. And that is why it is important that as a station that is centered on educating the people, we have brought to you today the discussion on coronavirus, otherwise known as COVID-19. And I have with me a professional of sort, a medical practitioner, someone that practices medicine for the benefit of humanity, not just to make profits. Not in Nigeria, but of course Nigerian in patriotism to ensure that coronavirus does not ravage us as a nation. It gives me pleasure to introduce to you Dr. Arun Gangada Balaganga. Is the Managing Director, India International Healthcare Nigeria Limited. Doctor, it's a pleasure to have you here.
Thank you.
Straight to the point, COVID-19 is a global issue.
Yes.
Can you say a few words about it?
Well, as you rightly said, everywhere around the globe, everybody is discussing about what is COVID-19, and the World Health Organization has already announced that it is a global pandemic. It has affected almost all the countries in the world, and definitely to talk about COVID-19, it started in China in a exotic meat market in Wuhan in 2019, and slowly from starting from there, and it has spread all over the world, and now we have many more cases coming up in Nigeria as well. We just started with one case which came from outside the Nigeria, and today as I'm talking to you, we have a report of 12 cases by the Nigerian Center for Disease Control. So, talking about the virus, coronavirus, it is not a new virus. It was discovered much earlier, but this particular strain of coronavirus is new to the humankind. And from the current research, it is mentioned that the virus started as a zoonotic disease. Zoonotic disease means a disease which is transferred from animals to the human beings, and from there the human to human transmission is happening. So what happens in COVID-19, or what makes it a difficult disease, is because the symptoms appear almost in most of the diseases. The symptom appears immediately, but in COVID-19 what happens is it takes up to 14 days 14 days for the disease to appear.
That is the gestation period now.
Well, we call it as an incubation period.
Okay.
That usually viruses, we cannot call it as a living organism as such, but when it enters a human cell, okay, there are two types of viruses, the DNA virus and the RNA virus. So this particular coronavirus, it's an RNA virus, and when it enters our human cells, it dictates our human cell to create its own prototypes. So that is why the viral load becomes bigger and bigger. So from there, that period of multiplication is called the incubation period, and mostly the symptoms are shown later. But it doesn't mean that that particular time the person cannot infect other person. That makes corona the one of the most difficult diseases to handle.
Now,
Yes.
as a professional, and that has been doing a lot of brilliant jobs on health care in Nigeria, how do you describe the level of preparedness and awareness? And do you think government is doing well enough in creating awareness and preparedness?
What I have seen on the awareness side is most of the public health professionals, the doctors, and the federal government is trying to create awareness, and the Nigeria Center for Disease Control is actively pursuing the situation. And every day, NCDC is publishing its report on its website. But awareness among the community is not something which we can create in a day. So because of that, and there are a lot of misinformations which is being circulated in social media as well. One of the earlier ones was because of the climatic condition what we have currently in Nigeria. It's very, very hot, humid climate, tropical temperate climate. So because of that, there were a lot of messages saying the virus cannot survive beyond 27 to 30 degrees Celsius, but it is not the case exactly.
Really?
Yes, because there are no proper evidence to justify that statement. So now we can see it in the country itself. So that was one. And another one, people were sending messages like eating garlic and drinking hot lime water can prevent the coronavirus infection and all. This is we are living in a modern age, and the garlic cannot keep the virus away. It will only, as I said, it can only keep the other person away from you. That is the only thing. So the awareness and preparedness, I would say, definitely in the airports and other places there are screening methodologies which are being used, but Nigeria and Nigerians have the knowledge of the Ebola period. So recently one of my friend was telling that some of them even take a paracetamol before deboarding from the flight, which actually fails the temperature test also in the airports. So these are all problems what we can actually face.
Now, from your analysis, there appears to be some level of activity to make sure that everybody coming into the country, particularly through our international airports, are actually checked.
Yes.
Now, as a nation with a very porous border, aren't you worried about the land borders?
Yes, of course.
And now that we have the issue with us, we have about 12 certified cases, right?
Yes.
It means that we have it already in the nation.
Correct.
And before our airports were shut down, some persons have already entered the country. Now, don't you think this does not have to do with the awareness process, does not have to do with government alone? Don't you think corporate organizations now should step in?
Yes.
What do you think?
Of course, it is not just the duty of the government to create the awareness, because the prevention of coronavirus disease is all our responsibility. So we have to join hands, in the sense, not in the literal sense of joining hands, but join hands to break the chain. So the preparedness has to start from at the individual level, at the family level, at the corporate level. Agencies in NGOs, CBOs, faith-based organizations, religious organizations, all should come forward, and they should try to educate and create awareness among the masses that this disease is real. It is not just a scam. Some of them were actually telling me, no doctor, it is just a scam. So it's not a scam, but it is a reality. And what are the preventive methods so that we can break the chain?
Thank you. Doctor, your organization, Indian International Healthcare Nigeria Limited, has been involved very actively in providing healthcare solutions to Nigerians. I've followed you very well on the social media.
Yeah.
You have rendered what can be termed as services that are not paid for. What inspired this?
Well, I started working in Nigeria as the state program manager for a primary healthcare project in Cross River State. That was my first entry point in Nigeria. And from there, I have seen that how primary healthcare of this country is, and as a public health professional, what I can contribute to improve the health system. And that was the aim for me, to start something of my own in this country, and try to bring in some kind of a quality and affordable healthcare, because the prices, most of them may not be able to afford it. So our aim is to reduce the prices without any compromise on the quality aspect of it. So we are more like a corporate social responsibility organization, that we are trying to do the responsibility towards the community, towards the citizens of Nigeria. And during the corona period, many of them may be even scared to go to the hospitals. So we have introduced something called a remote healthcare platform as well. So if you want to have a doctor consultation, you can sit at your home or your office space, and you can get a doctor consultation.
So how did they get it?
It is not a new technology to Nigeria. It's known as telemedicine. But usually the problems with telemedicine is the cost involved in it, and the kind of equipments what are involved in it. So but this solution, we are giving it to the common public for free. So it is just like a social media platform. You just need to sign up, and whatever the consultation fee individual doctors and individual hospitals charge for the patients, they just need to pay only that.
For the benefit of our viewers, can you avail them the platform, maybe on social media, or phone number, or what they can actually use to?
Yes, the platform is iihnl dot cartonhealth.com. That is IIHNL, Indian International Healthcare Nigeria Limited dot cartonhealth.com. This is our own inbuilt platform, so the data will not be shared with anybody else.
Okay.
Yes.
So I don't know, for the purpose of those that may want to, contact you through the WhatsApp or through phone call. Do you have any dedicated phone number?
Yes, we have a phone number 08113 200 300.
Can you repeat again, please?
08113 200 300.
Dr. Arun, tell us more about the Indian International Healthcare Nigeria Limited.
Well, Indian International Healthcare Nigeria Limited is a bootstrapped organization by a few developmental professionals, and we started with the aim to provide the quality healthcare at affordable prices. And what we are trying to do is we have different pillars where our organization stands. The clinic, or we have an outpatient clinic in Kubwa, which is a corporate social responsibility center. Then we have, that is the lifestyle diseases clinic, chronic diseases clinic, and we are the first organization in Nigeria to bring in something called genomic mapping. Genomic mapping is the genetic level study of a human being, and thereby you can predict what are the genetic traits and what are the genetic predispositions and conditions which can happen to a person in their lifetime. Accordingly, you modify your lifestyle so that your risk factors come down of reducing such conditions, so you live a longer life and a healthy life.
And you get prepared for.
Yes, what is there. But we are looking at something called personalized and precision medicine, from a stage that one drug fits all to unique medicines. That is what we are trying to move on to.
Wow, brilliant idea. Now, as a healthcare service delivery professional that have been in Nigeria for a while. They have been in the south of the country and in the north of the country. How can you, in few words, describe the Nigeria healthcare system?
Well, what I have seen is I have worked with some brilliant professionals in Nigeria. Nigeria has talent, Nigeria has resources. Uh, the proper channelization of these resources is required in this country, because there is a lot of brain drain from the country.
Mm.
So the brain drain happens because they have potential, but they don't have the opportunity to use it here.
Productive use.
Exactly. So if those kind of opportunities are available, definitely Nigerian healthcare system will develop further and much better than current situation. All over the world, if you go, Indian doctors have their own respect. The very same way, Nigerian doctors also have their own respect.
Mm, wow.
So the thing is that some of the very good
So
doctors.
the problem from your own perspective is systemic or something?
Well, who is the system? It is the citizens of the country who creates the system, isn't it? So I wouldn't blame it completely on a system or someone, but my point is that it is you who create the Nigerian system. So it is the responsibility of each and every citizen of Nigeria to create an environment for professionals to excel.
Now, back to the subject of discussion, that is the COVID-19. Now, with the cases that we have had now, how can you advise Nigerians to stay from being affected? Because for now, since you said it has an incubation period of 14 days,
Yes.
so it's so difficult for anybody to know, even if it's a
Sick or not.
yes.
Yes.
So, what is that preventive measure, in few words, that you have for Nigerians?
Okay. See, to understand that, there are epidemiological stages. That right now the infection didn't start from your country; it was brought from other places to the country. If you are able to contain and prevent it, it will not spread. But if you are not able to contain it, it will spread. The dangerous situation here is if the community spread happens, that from that exotic cases to some Nigerians, and from that Nigerian to another Nigerian, if it happens like that, that is community spread. That is a very dangerous, it will be a very dangerous situation in Nigeria.
What are those measures the people should take to prevent this community spread?
One, proper hand washing, that you should wash your hands or use a alcohol based hand sanitizer to clean your hands, because the virus can spread from surfaces, and when you touch some surface and you touch your face using the same hand, like your eyes, your nose or mouth, that is the entry point for the virus. So you should avoid unnecessary touches on your face and always make sure your hands are clean. Do not use sanitizer if your hands are dirty. If your hands are dirty or oily or muddy, use soap and water to wash your hands. Sanitizing is for hands which are already clean and to kill the germs. You understand? So ideally the soap and water can also do the cleaning work, but it may not be readily available, so you can resort to hand sanitizer to clean your hand. This is one. Second point is keep a social distancing, that at least if somebody is having a cough or a cold, keep a distance of at least 1 meter from that person. Or if the person is having a cough or cold, you can ask the person to wear a mask. A person who is not sick wearing a mask is not really advisable or not necessary,
Okay.
because a person who is having the infection and the person is wearing a mask means the droplets are not being spread. But if a person who is not sick is wearing a mask and the person who is having the illness is not wearing the mask, so what happens is the droplets will be there in the air, and the pores of the mask are so big that the size of the coronavirus is 80 to 120 nanometer, and the pores of the mask is much bigger than that.
Wow. So it cannot in any way prevent.
So the surgical mask is not exactly giving you the required prevention. But if a person is sick, if the person is wearing that mask, it will prevent.
The transfer.
Yes, exactly. Then avoid exotic meats or bush meat for the current season, because you have Lassa fever as well. So it is always better to stay away from exotic meat, and whatever food you are eating, cook properly and eat the food. Then avoid sneezing to the hand or coughing to the hand. In case if you have a kerchief or a tissue paper, you can always use to cough or sneeze to that. If you do not have an access to that immediately, always try to sneeze or cough to the elbow like this. Then as I said, do not touch the surfaces unnecessarily. That includes door handles, knobs, rails, all those places. Avoid public gatherings or mass gatherings, because we never know who is infected. So those gatherings it will actually intensify the transmission of the virus. So for the time period, we understand that there are religious sentiments involved in it. Some people marriage may be fixed or anything, but for that matter, for it is just for a it's not, yes, small period of time. So at least you can be alive and healthy to do those things. Yes, exactly. So these are the main things what you should be doing for the prevention, and to keep up your immunity. I may recommend you can have vitamin C tablets as well. Yes, yeah, vitamin C. There is no direct evidence that vitamin C will prevent coronavirus infection, but vitamin C will give you or improve your immunity levels.
Okay, but President Trump of America recently approved of chloroquine as a way of as a drug for COVID-19.
In fact, some of them say that it was actually a fake news.
Okay.
Some of them were making statement that it is a fake news, but I'm not sure whether it is a fake news or if it is a true news. But chloroquine, we don't use chloroquine much in Nigeria, and one of my pharmacist friend told me that chloroquine is banned in Nigeria.
Okay.
But I usually do my social media post. So 2 weeks back, in one of my posts, I had mentioned that some of the antivirals like lopinavir, ritonavir, oseltamivir, remdesivir, along with chloroquine, is being used in China to treat such cases.
Okay.
And chloroquine and remdesivir showed in vitro reaction to the virus. That means inside the lab when they tested, it was giving good result.
Okay.
So, and we also have one case in India where a doctor was treated with lopinavir, ritonavir, oseltamivir, and chloroquine, and he was found, yes, he was found tested negative.
Wow.
So my suggestion or my recommendation to the Ministry of Health also is that if there are provisions available, we can always try this in Nigeria as well.
I see
Yes.
what happens.
Yes.
Wow, it's been a very educating, very informative, and highly incisive time with Dr. Arun Dangada Balangana. He's the managing director of India International Healthcare Nigeria Limited. He's been a wonderful guest. He's given us phone numbers and the social media contacts for people who are interested in a follow-up discussion. I can assure you that it will be very useful. And he has also advised Nigerians on the measures we should take not to actually escalate the community spread of this pandemic that is in our hands. We have been advised to avoid public gathering, avoid ceremonies, just for this period of time, for us to understand how many people have been affected and how we can control the community spread of sin. I believe you have been well informed and join us some other time, same station, Sedali station, SGTV, and the program is you and your health. I bring us for day at day. Thank you.
Hello, viewers. I'm Dr. Arun. Keep watching SGTV for more updates on healthcare issues. Thank you.